Are you able to see that screen now?
Yeah.
All right. So normally I have another academic that assists with this unit, Crystal, but unfortunately she doesn't work on a Tuesday. She's working clinically, but she looks after the CT component of this unit. So that's our details. So if you if you've got any queries around the plain X-ray imaging, I'm the person to contact, and Crystal looks after the CT part of the course. And then I've given you a link to the unit handbook so that you can see the unit objectives that we have to cover for this unit. So you will see that it covers long bones, the girdles, the spine, the shoulder and the pelvis, and then also the chest as well. And then for the spine, we cover only the cervical spine. We don't cover the thoracic and lumbar because that's the crucial one in emergency. And when you look at the unit objectives, you are able to see that the majority of the objectives are actually leaning more towards the plain X-ray images. And then it's the last two objectives where CT comes into play. And also, as if you look at the timetable, you will see that there's more weeks dedicated to the plain X-ray imaging. There is another unit that follows on from this one, and that's RAD5201. And in that one, we do more CT and less plain X-ray, and that's there where we do the thoracic lumbar spine as well. So for this one, the focus is only going to be on the cervical spine.
Mm-hmm.
So the main reason why we actually brought in this unit was a request from the emergency physicians because they are junior doctors working quite often in one of the big emergency hospitals here in Victoria, and did not know how to interpret the images very well. And it has to do with experience. And even with experienced radiologists, there can still be mistakes. Nobody is 100% always at the time. And then it helps if there's someone else actually looking at an image to assist. So if there's an alternative pair of trained eyes to assist in making a diagnosis, because quite often there isn't always a radiologist available immediately to give a report. So it helps if you yourself can be more trained in doing that. Then there is a difference in the reporting. So there's a descriptive report and there's a medical or diagnostic report. So the descriptive report normally tells you, do you see anything that's abnormal? If you see the abnormality, where is it? And then to describe what you see. So for example, if you see a fracture, say a fracture of the wrist, so where is the abnormality? You would say it's the left wrist and it's the distal radius. And what do I see? The features are maybe that there is a dorsal displaced fracture, and that is the description that you're going to give. And then there is the medical diagnostic report, and that is the one that is the radiologist's responsibility, where they provide a proper diagnosis and also to think of what could be other possibilities, for example. So they might actually say this is a Colles fracture, although it doesn't mean you can't say it is a Colles fracture, but the final diagnosis lies with the radiologist. So the descriptive report then, just an example here is where's the abnormality? There is something going on in the chest, and then we can see that it's in the right lung. And what are some of the features that we see? If you look at it, there's some cavitation, there's a fluid level, and then also the surrounding wall is very thin, it's less than 5 millimeter. And also when you compare the right to the left lung, you can see that the right lung looks smaller, so there's a loss of the lung volume on the right side. So those are the descriptive features that we expect the students to give. Whereas with the medical or the diagnostic report, Could be there's a lung abscess, and that could be secondary to infection. And what else could it be? It could be TB, or it could, for example, be a primary carcinoma. So the radiologist report looks different than, the expectations is different from a radiologist report than from the technical report. The other thing to be aware is it's normal not to know, because sometimes you look at something, you're not 100% sure. And if you are not sure, it's much better to say, I don't know, than trying to second guess and maybe get it completely wrong. And that is something that we also teach our radiography students, because that's the time when you actually go and ask someone's opinion as well. So if you don't have a radiologist around, say I've been up to far north Queensland, for example, where the radiographers work without any on-site radiologist. And they would normally, through interprofessional collaboration, work with the referring doctor, whether it's the ortho people there, or the obstetric nurse, where they see something, and if between them, they don't know what it is, then they would call up a radiologist in one of the regional sites. And of course, the other thing is sometimes on plain X-ray, you might not be able to see what you need to see. An example would be, say, for example, if there's a query knee fracture, you can't see the fracture. However, you might see some soft tissue signs that tells you there should be a fracture, like a lipohemarthrosis. But because you can't see the fracture, that patient, for example, needs to be referred for a CT scan. So sometimes the answer is just not on the image itself. There might be some signs that tells you there could be a fracture, or there should be a fracture, and it means that alternative imaging should be done.
Are you going through the slides? Because I've still got the title slide up here.
Are you not seeing my screen?
I'm still on. It's still showing the first slide, the title.
Okay, let me just stop sharing, because on mine it shows that I'm sharing. So I'm on this slide that says diagnostic algorithm. So you haven't seen any of the other slides now before that?
No, it never went past the first slide.
That's odd. Can you see the one that now says diagnostic algorithm?
Yeah.
Okay, do you want me to go over the other ones?
Are you going to put it up on the...
It's on the Moodle site.
Yeah, then don't worry about it. That's fine.
Okay. So this is what I was talking about, that you might need other imaging tests, or sometimes it's useful just to wait. For example, if you are on a site where there's queries, say a scaphoid fracture, and sometimes plain X-rays doesn't show that immediately, they treat the patient as if the patient has a scaphoid fracture and comes back, say, within 10 days or so for a follow-up X-ray. Okay. Now, some of the resources that's available. So the Moodle site is the site where we post all of our information. Have you had a time to look at the timetable?
No, I haven't looked at it yet.
Okay. So the timetable is there. And then the other important thing about the way that we post the information is we post it up week by week. So normally I try, if I can, by a Friday, the latest Friday evening or so, to post the next week's materials. And that is to ensure, that the knowledge is just scaffolded, the material is scaffolded as you learn through the time. So it's uploaded on a weekly basis. And that's why if you go on the Moodle site, you will only see this week. You only see the 3rd of August, but you won't see the rest of the weeks because that stays hidden until we get to at least the Friday before that. Sorry, this thing just went on. And then there's some e-resources available. We have got an image interpretation manual that's available as an e-resource. And then some of the PowerPoint presentations I will video record. We also have a number of books that's available as ebooks. So if you look on the slide, you will see there's a reading list, and there's a link to the reading list. And then when you go click on that link, it will look like this. And you'll be able to see that there's quite a few of those resources that's available online. So you don't have to go physically to a library. You can actually, from home, you are able to view those resources online. What I normally do, so say for example, the second book is one that I use quite often by Otto Chan. Say if we are doing something on the shoulder, I normally link it so that when in that week, there will be a link specific to that chapter, which will take you then directly to the shoulder, so that you don't have to scroll through the whole of the book. So that is available through the library list. We don't use all of those books, but the others are available as additional resources. Please feel free to stop me anytime if you've got any questions.
No, I'm good.
There's 4 assessments linked to 5201. And the first one is on psychophysics. It's a 30-minute exam, and all the exams are done through the Moodle site and under the assessment taskbar. So you won't see the assessment taskbar yet because we haven't set the exams up. But the first exam will be the week of the 14th of September. So I normally, the week before that, I email the students and ask them, you know, in that week, but it has to fit in with my calendar as well, what day and time would suit you. And then I set the exam specific then for, as you are the only student, I don't have to negotiate a week and time. So I'll set that up to fit in with your timetable, with your roster. What I've done in the past, if for example, if for that week you work full time during the day, I've also set it up to run after hours. The latest that I can start an exam is 7 o'clock in the evening, because I don't have any IT support after that, if anything should go wrong after that. So if you find that in any of those weeks where we run exams where you are not able to do it during the day, I can do it after hours as well. And then there's 2 other online exams apart from the first one, which is the psychophysics one. So the second exam is just focused on the plain X-ray imaging, and that will be all of the body regions that we've mentioned. So it will be the shoulder and upper limbs, pelvis and lower limbs, C-spine, and also the chest. So that will, the plain X-ray ones will be in that one, and that is the week of the 16th of November. So after we've actually completed all of the learning material. And then there's another one as well, the third online exam. That one is only focused on CT. And you can see it's a shorter exam, and it has a less weighting because there's less learning outcomes attributed to CT. And then the final one is the submission of a medical imaging portfolio, but I'll go over that one with you once I've finished with this presentation. The other important thing to know about the assessments is that each assessment is a competency hurdle. What that means is that you need to get at least 50% to pass that assessment. So say for example, for the first exam, you don't pass it, then you get a second opportunity to undertake it. And if you repeat the exam and you pass it, then you get 50% for that. So a hurdle requirement means you actually have to pass each of those assessments. Now the first exam is a smaller weighting, it's 15%, and it's a mixture, it will be a mixture of multiple choice questions as well as short answer scenarios, and you'll get that information next week. And a part of that comes from that clinical workbook that we have online as well. And I have lectures and PowerPoint. So from next week onwards, you'll get that information for that exam. In the second exam, as I said, that's the plain X-ray exam. and it will cover all the materials from the 10th of August to the 5th of October. And there's a number of books that's available. Now, I also make available one of the books that our undergrad students use, and that they use to learn the different positions and projections. The reason why I do that is because in the postgrad course, not everybody is radiographers. So it's quite useful to know what projections are being taken, and then also to know how to identify the anatomy on that. And of course, this exam will also take place via the Moodle platform. And then the third exam, which is our CT exam, again similar, so different textbooks that you're going to use for that. And that will be the material covered from the 12th of October to the 2nd of November. Now, the medical imaging portfolio is the last assessment that you will be submitting, and that deadline for that is the 4th of December. It's a Friday evening, so 5 minutes to midnight. You should be able to upload that. Now, the expectation is that you will have 25 case reports. And I need to ask you now, as a paramedic, will you have access to any case reports? Is there any way that you can get case reports?
Not routinely, only very occasionally.
We'll have to see. With the, I'm just wondering how we're going to manage you in terms of that, the case reports. And you will probably also not have access to CT imaging.
I definitely won't have any CTs. I might have x-rays, but not 25. I definitely won't have any CTs.
Yeah, yeah. I'll have to talk to Crystal about that and see how we're going to manage the portfolio. I'll go through the portfolio with you just now, so that I can explain, you know, what is the normal requirement for this unit, and maybe see whether there's any way that you could access some imaging. I don't know if you have got, if you regularly visit certain sites, or don't you really?
We go to Cobram Hospital, but they're pretty funny about giving patient information out.
Yeah, yeah.
And they only have an x-ray, they don't have a CT scanner.
Okay. All right. Okay. I'll go over the portfolio in a minute, and then we can maybe try and think of an alternative for you. So the main thing with these units are it's very self-directed. So throughout, there's 12 weeks of teaching that happens. And then through that 12 weeks, I'm just going to stop sharing now and also stop the recording at this point.